Some Rhode Island healthcare workers are now being required to get the vaccine. Good evening, I'm Shannon Heggie.
I'm Mike Montecalvo. Governor Dan McKee making the announcement today during a COVID-19 briefing as new cases and hospitalizations continue to spike in Rhode Island.
12 News reporter Anita Buffoni was at today's briefing where the governor also updated his plans on masks, especially in schools. She joins us live from Providence with the details. Anita?
Well, Shannon and Mike, the governor said today that there will not be a statewide mask mandate, while at the same time saying he expects but doesn't require superintendents require masks in schools. This comes as school districts are mulling their plans since the decision is being left up to them.
It is time. It is time to get vaccinated.
Governor Dan McKee once again making the case for Rhode Islanders to get the COVID-19 vaccine. Roughly 195,000 who are eligible have yet to get their shot. With the start of in-person school approaching, the governor says they are connecting districts with vaccine clinics. Whether students will mask up is being left to school districts to decide. Despite that, the governor had this to say to superintendents as they draft their policies.
I would expect the superintendents to follow the CDC guidance.
That guidance is recommending students and faculty wear masks indoors regardless if they are vaccinated. While the governor isn't mandating masks, he is requiring workers at state-licensed healthcare facilities get the vaccine by October 1st. A mandate for all state workers is being discussed. A reason? The Delta variant becoming more widespread.
Because of this heightened contagiousness and transmissibility, we estimate that more than 75% of our cases are likely now Delta variant cases.
Now, I did ask the governor if he supports requiring vaccines among teachers, but he said no, citing that there are already about 90% of vaccination rates among Rhode Island teachers. For now, live in Providence, I'm Anita Buffoni, 12 News.
First tonight, Governor Dan McKee has a message for vaccine holdouts.
He delivered it this afternoon at his first COVID-19 briefing in weeks.
If you haven't already, it is time to get vaccinated. It is time.
The governor has also announced a vaccine requirement for some healthcare workers.
McKee says Rhode Island's relatively high vaccination rate has so far kept hospitalizations and deaths from spiking alongside the rising cases. Though today's Department of Health report, the first since last Friday, shows the number of people in the hospital did go from 40 to 66, and weekly data shows the number of hospital admissions have nearly doubled from the week before.
12 News reporter Anita Buffoni fills us in on the new vaccine requirement and what health officials had to say about masks and schools. Anita?
Well, Mike and Shannon, that new vaccine mandate for workers at state-licensed healthcare facilities is largely due to the Delta variant becoming more widespread in Rhode Island. The health department estimates roughly 75% of all positive cases here are that more contagious strain. As the governor mulls the idea of making the COVID-19 vaccine mandatory among all state employees, Dan McKee announced Tuesday workers at state-licensed healthcare facilities must be immunized by October 1st.
We're going to mandate that because we know that that's an area that is at a risk, and we don't want to take any risks.
This comes as the Delta variant becomes more widespread in Rhode Island, making up 3/4 of all positive cases here. The health department saying past exposure to COVID-19 doesn't mean you're protected against the more contagious strain.
The natural immunity that you developed did not include antibodies against the Delta variant.
Your best protection, health leaders say, is to get the vaccine. The FDA is expected to soon make a decision on whether booster shots are necessary for people with weakened immune systems. Rhode Island leaders say they are watching what happens closely on a federal level.
Say we're prepared to administer a booster if it's decided that it's needed to every single Rhode Islander.
As for schools, McKee says he is connecting districts with vaccine clinics to boost rates among students ahead of the fall semester. It's still being left up to districts to decide their own masking policy. And with the demand for testing that's increasing, the state says they are opening more testing sites and increasing their capacity. Live in Providence, I'm Anita Buffoni, 12 News.